At 28 minutes past 9, we delve into this story. The World Health Organization's Africa Regional Office unveiling a landmark shift in how the continent trains its health workforce. Speaking in Pretoria, WHO officials launched the first ever Africa prototype competency-based curricula for 10 key health professionals, a move hailed as a game changer for strengthening health systems across the region. We now in conversation with Professor James Asamani, a health economist and health systems expert at the World Health Organization. A very good evening to you, Professor, and thank you so much for speaking to us.
Thank you very much for having me, and good evening to your viewers and listeners.
In understanding what you've done and why it's game changing, could you just please contextualize this? First, tell us about, particularly health systems in Africa and the economic perspective of it. What have been the specific gaps or inefficiencies that exist, particularly in the current training models?
Yeah, thank you very much. In the African region, we have a single purpose, trying to improve our health systems to be able to deliver universal coverage of health services to the population. There are several issues that we have observed that necessitated the development of new competency-based curricula. One of it is that countries have observed that the health workers they produce have variable quality in terms of their ability to perform right after school. That means they have to spend more money to train them on the job. And some assessments that have been done in recent times have shown that some countries, we've seen that health workers are able to pick up correct diagnosis of common ailments. We're not talking of very complicated illness, common ailments, up to 60%. And sometimes the treatment they give is compliant with local treatment guidelines by up to 35%. What this means is that there are people who would come to health facilities for treatment whose diagnosis would be missed, or who would receive treatment that need to be repeated or need to be changed at some point. And that represents resources that are lost or wasted. It could have been prevented if the health workers were better prepared differently. Now, looking at this, when we turn the curriculum towards competency-based and move away from more theory and practice later, then we prepare health workers who can come and immediately be useful for the health system and reduce the wastage, and we can channel those resources in further strengthening the health system.
So when you look at member countries and their ability to deliver just in terms on curricular-based competencies, were there countries that stood out? Were there countries that were worse off that helped you remodel this in such a way that there is a standardization across different regions while appreciating the varying levels of resource availability?
Yes, so different countries are taking different steps, and every country is doing some kind of reform or making some progress to improve their training and education of health workers. But some countries are a little bit more advanced than others, and capacity also varies from country to country. In designing the curriculum, we attempted to ensure that it was fit for purpose and reflected the African realities. So we consulted as widely as possible academics from the south to the north, from the east to the west of Africa, regulators, and practitioners themselves to understand the realities on the ground and to ensure that the competency outcomes contained in these documents reflect our shared reality. Of course, we do understand that given the resource availability and even sometimes the readiness of the policy environment, countries will move at different pace. And we do anticipate that localization and adaptation of the curricula would be important for every context.
So just then take us through what you have done in these consultations with countries and what has been the economic reasoning behind this shift.
The consultations we've done with countries two two levels. The first level is we've tried to understand from countries what are you looking for in the next generation of health workers. Then we understood that countries wanted health workers who will come and help them use the limited resources they have in the health system to deliver the most outcomes that they can get from it. That means countries want efficiency. In Africa, for every $5 that you put in the health system, $1 goes waste. It's not necessarily due to workforce alone, but the workforce is a key contributor. Now, countries want to avert this for the most part and ensure that resources are channeled for the benefit of patients. To do that, countries further informed us that the current way they train health workers means they wanted to change. And that change is they wanted the training to focus on what the students, when they finish, they can do, not what they can remember. So this is the kind of consultation that the information we receive from countries, which informed the need for us to switch. Then in November of 2024, we convened the countries, including ministries of health, some from ministries of education, regulators of health professions, and the health professions associations in Zambia to dialogue over a week. The conclusion from that dialogue was that it was time to begin the process to switch towards competency-based education. Even if it is not a one-day move, we need to get started.
And that's exactly what I was going to ask. How long would it take? And are there going to be pilot projects in certain test countries? And can you just also speak a little bit more about the 10 priority health professions that you will be targeting?
Okay, so I don't know whether to use the term priority health workers. Um, Sometimes it could connote that those not included in the
Yes.
first are not a priority, but they are all a priority. Um, Due to different demand and also resource constraints, we had to start with 10 and then we can expand and move on. So these 10 initially that we started includes the undergraduate medical education, those who complete university to become your general practitioner medical doctor. Then we also have pediatric specialist, general surgery specialist. We also have obstetrician and gynecologist. Then we also have for nursing, emergency nursing, critical care nursing. We also have pediatric and child health care nursing. Then we also have the community health workers. And one key area, maybe we've not talked much about it, is information and data guides decisions in health. So we have a curriculum for health information systems. So these are the 10 that we have started with, but there are plans to, as soon as possible, tackle other occupations.
So this new model that you are adopting, this shift that you are embarking on, can you just also share its projected long-term cost savings and efficiency gains, particularly against the background of the objectives of the Health Working Force 2030 goal?
Okay, so to put this in context, it is not an isolated intervention WHO is pursuing with the member states. This is part of the broader workforce agenda to address workforce challenges in Africa. One of the major issues that this would address is that we do have a huge shortfall of health workers. Is estimated at the moment at 6.1 million by 2030. But if we were to improve the competencies of health workers, this shortfall could be cut. Remember, this shortfall is estimated taking the assumption that the competencies remains the same. So if we can improve competencies, this shortfall would cut. And we anticipate that when this shortfall is cut and we are able to also reduce poor quality outcomes from service delivery, we will be able to make substantial cost savings. This will vary from country to country, And in a few countries that we have done this simulation, we've seen that the return on the investment needed for this change in curriculum, not just curriculum, but approach to education, could be as high as 1:10. So there is a potential to really save for the health system by improving the education and training of the health workers towards competency-based approaches.
And just finally, what are the regional disparities when you compare Africa's case with others?
In terms of the training approaches?
Yes.
Okay. There is a wide disparity across Africa in terms of the, the approach to training and the quality that comes thereof. And I will not be able to mention countries specifically to say this country has a good program or a program. But one thing that is key for us is that we are aiming to facilitate harmonization and integration of our labor markets. To do that, we first need to have the foundation, which is the standard to follow, the curriculum. So the curriculum we have done is a prototype, and we anticipate that countries would work to adapt to their context by at least 60 to 70% and leave 30 to 40% to add their context to it. So the 60 to 70% will be the core, and they add their context 30 to 40% into what we would call the national reference curriculum. And they would work with their institutions in country to also adapt that national reference curriculum into the institutional context and align by at least 80%, leaving 20% for each institution to add their context. Then eventually, we are developing also what we call the Africa Health Professions Education Quality Standards. So countries that have implemented the competency-based education to a degree they feel satisfied, we undertake a benchmarking of the country against the quality standards. And countries that have similar scoring can now discuss how to recognize each other's qualification. So this will gradually, over time, will no longer be something that we are aspiring for, but it can really enhance integration and similarity of training across Africa.
Professor James Asamani, I really thank you for your time. He is a health economist and health systems expert at the World Health Organization. Brings the time to 20 minutes to 10.